go. So we heard this morning how cooperation and meaningful collaboration between all players involved in the ecosystem, such as industry or government official, is key to tackle misinformation in Europe. It takes place in many different initiatives. We heard, for instance, this morning, the EU Commissioner Vera Jourova and Matt Britton, Google EMEA President for Business and Operation, mentioning the EU Code on Disinformation. Another fundamental point was media literacy. It was essentially stressed by Alexander Stubb, former Prime Minister of Finland, and Emily Evans, Chief Executive of the Economist Educational Foundation. Emily stressed that young people should be better equipped with their critical thinking. They should have a knowledge of what's happening in the media, and they should know how to identify reliable sources. She also added that young people should have in-depth knowledge of what's happening in the news, be equipped with good communication skills to dare speak up and exchange on what they read online. So I'm going to ask each panelist for the opening remarks. And if you could share your experience on how you believe health and misinformation evolved with COVID-19, how cooperation is important, and how media literacy can be part of a solution to address health misinformation. We're going to start with Mevan Babakar. So Mevan, you're the Chief Operating Officer and Deputy CEO at the UK leading fact-checking charity, Full Fact. Full Fact is a team of independent fact-checkers and campaigners who find, expose, and counter the harm it does. Mevan, thank you for your introduction remark.
Hi, everyone. I'm Mevan. As discussed, I've got a minute to cram in as much as I can. So I think one story I'll tell about the COVID pandemic is around 5G. The first time that Full Fact fact-checked 5G was in 2018. And we said that the next time this comes along, there's a big health event or there's a big technology event, the 5G conspiracy theories that we're seeing in 2018 are going to become embroiled in the next big thing. So we took that information, we took these stories that we've been seeing, and we went to Public Health England, we went to governments, and we said, somebody needs to fill this information gap. And if you don't, it will become an issue. Nothing happened. Then the COVID pandemic hit, and lo and behold, that information gap meant that people joined up these pieces of misinformation, filled in it with stories and conspiracy theories that all revolved around 5G. And we saw people taking down 5G masks, blaming COVID as a result of this. And that could have been avoided. It could have been avoided if we heeded this warning, we took the trends that we had seen over time, and we actually did something better to fill that information gap. I'm really excited to talk to you all about some of the other things that we've been doing at Full Fact as well, with a few more stories littered throughout today.
Thanks, Mevan. I'm sure we'll discuss further how misinformation evolved from 5G to COVID-19. So let's now go to Jakub Goda. You work for the Office of the President of Slovakia and cooperates with the Ministry of Health, where you help improve digital communication and fight disinformation. You're also known as a writer and an activist who looks for innovation way to expose misinformation and raise awareness about the problem. So please.
Hello, nice to meet you. So sorry for being late. I think I ended up for a while in different breakout rooms, so I was a little bit confused. As you mentioned, I'm trying to help the institutions, the public institutions, to be more competitive in an online space, because traditionally, I think the government institutions or the public institutions in general are not accustomed or are not used to be present online in a way that would be visible and competitive towards disinformation. So that we are trying to tackle with Ministry of Health and also in the Office of the President. And it seems the pandemic kind of proves to us that if the official institution communicate in a really creative and proactive way in online environment, there is a huge demand, because people are kind of demanding the information that they know that is official, but they also they're looking for it in their environment that are kind of used to. So that there are currently social networks quite heavily. And if we are able to present the information and present the official communication in a fashion that is kind of modern and creative or easy to grasp. It seems like it can work and it can spread organically, and even like journalists and famous internet celebrities are then reusing this communication, spreading it organically, kind of producing different materials out of it. And it can be fairly influential in the online environment. That might take away from the pandemic and from my cooperation with the government institutions.
Thank you, Jakub. Very interesting to hear more about how public figures and influencers can contribute to challenging and addressing misinformation. Let's now go to Professor Brihan Mcrae. You're the chair of the Irish Government COVID-19 Task Force since November 2020 and the chair of the Irish Government Commission on the Future of Media. You're also the president, or were the president for 10 years of Dublin City University. And the reason those 10 years, DCU grew significantly in terms of scale, footprint, and reputation. So you've got a lot to tell us about misinformation and COVID-19. Go ahead, Professor.
Thanks, Victoria. My name is Brian, and I'm delighted to join you all this morning. As Victoria said, I was a university president for 10 years up to the summer of 2020. And rather than let me relax at that stage, the government asked me to do two things. One is to chair a commission on the future of media, and we've submitted that report to government. I can say a little bit about it, but not too much because they're still deliberating on it. But the bigger task I was given was to chair the National Vaccination Task Force from last November. So that's been extremely busy. Just to put it in context, it has been very successful by any measure. Our current numbers are that 92% of adults are fully vaccinated. And even looking at those 12 years old and above, nearly 90% of that age group from 12 and above are fully vaccinated. But one thing I learned certainly was the critical importance of communications and public engagement. And I'm happy to talk in a few minutes when you ask the questions, but partnership with social media platforms and tackling mis and disinformation was a central part of that success. That success has many elements to it, but I'm certainly sure at this stage that actually a clear strategy and clear partnerships in those areas played a pivotal role in the successful program.
Thank you so much, Brian. And now, last but not least, Amanda Storey, your director in Google Trust and Safety team, which work on the process, policies, and algorithm to spot and disable bad content and remove bad players from Google system at scale. So the floor is yours, Amanda.
Thanks so much, Victoria, and nice to see everyone today. So as you've heard from others today at Google and YouTube, information quality is really at the heart of everything we do. We talk about the 4R framework for managing information quality, so raising authoritative voices, removing harmful content, reducing the likelihood that borderline content is recommended, and making sure that we only reward or provide monetization around content that is really high quality. So that's kind of at the heart of everything we do. I think in terms of the conversation today, kind of two pieces that I see as being really important here. One is around meaningful transparency, both for users and then for officials and regulators. So on the user side, efforts like About This Result, where we provide more transparency, more context, as Mevan was saying, about the results that a user is seeing within search. And on the regulator side, efforts like the Digital Trust and Safety Partnership, where we're creating a framework for regulators to audit our content moderation practices. And then collaboration. So that's really been the focus of today. And I think absolutely collaboration on these kinds of topics is critical. Collaboration with authoritative sources to make sure we're getting really high quality information out to users. And we heard Jakub talking about official sources and the value users place on that. Trusted flaggers, I think, play a really important role here, as do fact checkers. And then across kind of industry, academia, how do we come together to solve some of these issues? And we're really delighted to have the Google Safety and Engineering Centre in Dublin as a forum to do that collaboration, do that co-creation. So delighted to be here today.
Thank you, Amanda. And indeed, it's pretty important to highlight the different players, like such as trusted flaggers, who are involved in addressing misinformation. So thanks for bringing this up. So my first question is going to go for Brianna and you, Amanda, on the collaboration, which has been a major theme of today's summit. In what way did you see the collaboration change with pandemic, and how your interaction with other parties of the ecosystem has changed? maybe as a sub-question, we can go further into details.
Amanda, do you want to go first, or will I?
You go for it.
Okay, thanks very much. Yeah, well, certainly in looking back over the past 11 months, any success we have had was truly down to a collective national effort, and a collaboration in the whole area of communications and public engagement was central to that, as I mentioned already. We are fortunate in Dublin, and you've heard it mentioned already through the Google Engineering Centre, but we have the European headquarters of Google, Facebook, LinkedIn, Twitter, TikTok, YouTube. All I can be in those places within a half an hour of my office, and we availed of that from day one. So the very first thing I did was we held a Zoom meeting with the leaders of all of those organizations in Dublin, and we brought the heads of communication teams across what we call the Health Service Executive, which is the equivalent of the UK NHS, and our Department of Health, and they worked together. And we said, look, what are the things we can do? And three things come out of this. One is when people started searching for information on COVID or specifically vaccines, the platforms agreed to immediately have a pop-up, direct people to the locations of trusted information in our Health Service Executive. Ireland's 5 million people. In the past year, we had 20 million visits, over 20 million visits to those sites. But again, the cooperation and support of all the social media platforms was important. Second collaboration point was on the agile removal of misinformation. And I think that's been important. You've heard that mentioned right throughout the morning. Just in recent days, a policy from YouTube was shared with us, and they indicated that any harmful misinformation about vaccines that have been approved by the World Health Organization, the European Medicines Agency, or national agencies will be removed swiftly. That was important as well. And the third one is interesting, and that is the people doing the work on communications and day to day within our Health Service Executive. They were matched up with individuals at their level within those various social media platform organizations, but that relationship was endorsed from on high. So it really meant that worked very, very effectively indeed. The last example I'd give was, and I think one thing we learned is we had to make sure that information was arriving at people that the information was targeted and nuanced to their background, to their age, to their demographic context. We engaged with a lot of young scientific and medical researchers, and they formed something called a SciComm collective. And they were out on social media platforms providing information in the language, but with the robustness of their expertise to people, of particularly young people. And we found that any slight hesitancy we encountered was at the younger ages, but it was very slight. But having young people's voices on social media platforms, but with scientific knowledge, really worked very, very, very well indeed. Many other things I could say, but I'll hand over to Amanda.
Thanks, Bryn. So yeah, completely agree. I think that collaboration with health officials in each country around the world was absolutely critical in the early stages of the pandemic. It was moving so quickly, and we had to be agile, we had to innovate, we had to do things in ways that hadn't been done before, because there was really no other viable path. We worked with, in the end, 85 different health authorities and public health experts to make sure we were creating information panels that users saw across all of our different services, to make sure they were getting access to high quality information. And one of the stats I found really mind-blowing is that those information panels around COVID on YouTube were seen 600 billion times. I mean, the reach of that in terms of getting the right information into users' hands quickly was just phenomenal. We also worked really closely with governments. So we provided 250 million in ad grants for the WHO and other governments to get information out to users, particularly around prevention of COVID very early on. That was something that the governments really wanted to get into users' hands early. And then also with the fact-checking ecosystem, recognizing that misinformation was rising quickly, and there was so little information known about COVID that space was filled by all sorts of theories. And we provided 3 million to journalistic fact-checking efforts, particularly focusing on projects that would reach audiences that are traditionally more underserved by fact-checking. So I think that kind of authoritative source engagement, government engagement, fact-checking engagement was really critical to be agile in the early days.
Thanks so much, Amanda and Brianne. I saw Mevan and Jakub nodding a lot, so now let me allow you to come to you. Um, what for you did work and what didn't work when it comes to addressing health misinformation based on your day-to-day? So also as a follow-up question, how can you apply some of the learnings from COVID to upcoming political problems? So for instance, Mevan, you had lessons learned from 5G. What are your lessons learned following COVID-19? So let's maybe start with Mevan. Thanks.
Great. So some of the things that did work for us really is just applying the fact checking that we've been doing since 2010, but applying it at a slightly different pace. We've done lots of political events, and the political events are very squashed. Basically, the country wakes up to misinformation 2 days before an election, and that's really when everyone is most politically active. Whereas in the pandemic, the attention was spread incredibly throughout the whole of the 12-month period, let's say. It was really consistently high, which was a level of attention that I'd never seen before on fact-checking websites, or on even just Google searches, I'm sure were as high. So it was interesting from that point of view, whereas in a political event, we need to make sure that in the last few days, we have everything that people need ready to get it. This was an emerging event where people were always switched on, always looking for things. So it required us to more heavily go back and update fact checks. It required us to be more clear that the evidence had moved on, and the evidence moved on a lot during this period. And it was really important to tell people that there was a time limit on this information. So I think that's something really that needs to be applied more broadly throughout fact checking in total, but also to all information. Information moves on, and we need to have a timestamp on it. The things that worked really well for us as Full Fact in particular, we've been developing tools that I mentioned in the video earlier on that help us monitor claims at scale. So these are 2 algorithms in particular. One that does claim detection. So this is identifying a sentence has a factual claim in it or not. And that allows us to actually take sentences and then split out all the ones that are factual and then do smarter things with it, like show me all the claims made by Boris Johnson in the last 24 hours on COVID. And we can actually get that level of specificity, which is really helpful for us to try and track things over time. The other algorithm that was really helpful for us does repetitions. So every single time that someone spots something, so every single time someone says something that we already know is false, understanding where it's being repeated, who is repeating it, and then that allows us to do more, like to go and understand why is it being repeated. We've already fact checked it. What is the source of this new piece of misinformation? Why is it being propagated? And that allowed us to do something that we did more earnestly this time around, which is get corrections. So we asked people to correct the record. We asked politicians to correct their statements. We asked news outlets to edit journalistic pieces that are going viral but have clear pieces of misinformation in them. And those tools really allowed us to do that at a different scale. And also during this pandemic, we also shared these tools in Argentina with our Argentinian fact checkers, Chequeado, in Africa, across Nigeria, Kenya, and South Africa as well with Africa Check. So for the first time, we could also see what are the claims that are traveling between these countries, what are the ones that are being repeated in Nigeria, and then actually we're seeing again in the UK, potentially because of diaspora communities. And that level of information was really fascinating, and it allowed you to borrow down into where are these pieces of misinformation, how are they traveling around the world, where are the communities that link people up. And finally, one of the things that I really, really enjoyed seeing this pandemic was our work with communities. At the very beginning of the pandemic, we were trying to do kind of what are the biggest claims that we're seeing? Let's make sure we hit the biggest claims so that if people search things, they have the biggest things that they're looking for, they have good information for. But as the pandemic grew on and as more and more people got vaccinated, we realized that the problem was changing not to how can we serve the biggest community, but how can we serve the communities that have specific issues and specific pieces of misinformation being targeted at them that means that they don't want to get the vaccine. So we know that ethnic minorities in the UK were under-vaccinated for a very long time. That's going up now, thankfully, but the next group, in my opinion, was pregnant women. And pregnant women are not being vaccinated at the same rate as everyone else because they have concerns, understandable concerns, because there's not much evidence, but that evidence is now growing. So one of the pieces of work that we're doing with the community, particularly, we have a partnership with an organization called Pregnant and Screwed. We have a WhatsApp line where pregnant women in that community can directly ask us about pieces of misinformation they're seeing. And also that allows us to make smarter choices about what are we going to fact check for this community and how can we get the best information back out there to them. And that project is coming to an end now, but I'm really excited about evaluating it and seeing, has that provably meant that more pregnant women get vaccinated at the end? Regardless of whether it does or not, I know offhand that we have had women contact us and say, thanks to these fact checks, I have changed my mind. I feel much more confident. I feel much more secure. And I know that getting the vaccine is better for me and my child than not. And I think just even one or two cases makes that all worthwhile. So all of those pieces of learning are going to be things that we draw into our fact checking day to day in future.
Thanks, Mevan. Jakub, do you want to add something based on your experience, how you saw things working or not working? You're on mute.
Thank you. I think I will have to start with admitting that actually Slovakia is far from being a success story when it comes to the vaccination rate. We are quite low. We are at 45%, which is quite low. And the key reason for that is that vaccination has become a culture and political war in the country. We are probably one of the few countries, or maybe the single one, where the whole mainstream opposition is actually subversing or adopting the vaccines. So that's something really difficult to tackle, because when it became a culture or a political war where you have actual mainstream leaders spreading these anti-vaccination messages, not only online, but even in TV, in the mainstream media, wherever they can reach, that's the point where this is no longer a rational debate, and it's not only about fact-checking or debunking or providing the proper information. It's, for many people, it has become a part of their identity. It's really strong emotional attachment towards these messages, and also it's hard for the, I think it's that would be my question, maybe, how the platforms do handle this when the mainstream politician, the actual opposition leader, is spreading these sort of messages, because it's something, it's different compared to like some kind of random disinformation websites. So sorry for the pessimistic tone, but this is the short story here. Even though there is even though we at the Ministry of Health, we are trying to be really present and active in social media or in online space, we are reaching quite, I think, decent numbers when it comes to our number of engagement, shares, reach, the way how the information is being spread, how it's being reused, and how we are able to figure out new formats to kind of organically even reach the audience. It's far from enough, mainly when the opposition or the people who we are facing are not random disinformation websites or like some kind of hoaxes online, but they are actual political leaders who have strong trust in certain part of population. So this is kind of a different story, and when it comes to this emotional level, it's kind of unclear how to tackle this. Even though I think what was said before by Mr. Mcrae, I think it's really interesting how Ireland is holding this, how you are having this kind of regular meetings with platforms, And I think the importance of the government communication is really high, but it's hard to imagine how to convince the groups of population that are really emotionally attached to the leaders that they trust and who kind of subvert the vaccines and spread the anti-vax messages.
Thank you so much, Jakub. I think you're right in many of your points. I still have a few questions, but I see there are a few in the Q&A, so I want to make justice to Kirsten Davis and the 4 people who voted for him or her question. I don't know. So let's have a look at the Q&A. We see a lot of focus on media literacy for children and the youth, and there's a large potential of fake news shares, which are made by senior users. They have more access to the vote, or they turn out to the vote in greater number. So what can be done to tackle this specific group of the population? So maybe more senior user that spread misinformation. I don't know who wanna give it a go. We have 4 minutes left. I'm gonna ask you just to keep your answer quite short, if possible. Thanks.
I'd love to just pick up on something Mevan said about context. I think you're absolutely right that part of reaching this kind of audience, this more mature audience with a good understanding of information quality, is to provide that context, to actually show them, where has this information come from? What is the site? When did the site come online? So we have this tool called About This Result, where we provide that information about the source from Wikipedia or a description the site provides of itself, what others have said about that site in terms of news and reviews, and more information about the topic that site is talking about. I think features like that, as well as features like the Fact Check Explorer tool, where a user can go and actually look at fact checks on a particular topic or in a particular language or from a particular publisher, are really useful tools to provide that sort of context to users, particularly to challenge the sort of affiliations that Jakub was talking about.
Thank you so much, Amanda. Brian, you want to add something?
Yeah, just 20 seconds. I mean, the question about media literacy, certainly in our work for the Future of Media Commission, it is very, very clear that it's now one of the most important elements of the broader education experience. And it has to be happening at all layers of what we would call the education continuum, right from, early years right through to lifelong learning, that in order to protect and strengthen all parts of our society, media literacy has to be a central issue. It's as straightforward as that, I think.
I would add that I think that I agree with everything that's been said before. It has to be a lifelong thing, but I also think specifically with any population, to be honest, not just older people, it has to be done through intermediaries. It has to be done in partnership, in community groups that people feel part of, like things that are part of people's identities, so that it's a bit more easy to accept in conversations with friends and family. And I think one of the interesting things is, how do we equip people in those communities to have conversations, and how do we equip friends and families to have those conversations? And I don't think we have good answers to that yet globally, to be honest. I know there's a lot of interest in media literacy, but in terms of how do you create a safe space to have a difficult conversation, I don't think there's enough on that.
Thanks, Mevan. Maybe looking at the time, we have a bit less than 2 minutes. I'm going to invite the 4 of you to maybe have short concluding remarks, or if you want to react on what of the other speakers said. So I'm going to start with Jakub this time. If you can unmute that.
Well, I think it was really interesting to hear these different perspectives. For me, it was mostly the most inspiring was what Mr. Brian Mcrae has said about the Ireland experience. Yeah, I mean, I don't have much to add, so thank you.
Thank you, Jakub. Amanda, if you want to go next.
Thanks. So yeah, I think this focus on context today, this focus on how to reach audiences, even those who are maybe harder to reach under normal circumstances, is really critical. And then continued collaboration. So with fact checkers, with flaggers, with authoritative sources, government entities and officials, that's the way to make sure we're getting authoritative information out to users at scale. So we want to continue that collaboration, as well as working on our core 4Rs levers to manage information quality across Google services.
Thank you so much. Mevan.
One of the things that I'm really excited about is this global rollout of our tools that we're developing. So it's going to be shared with more countries. And I'm going to leave it there.
Thank you, Brian.
Big friend.
Collaboration, collaboration, collaboration.
Thank you so much for being with us today. And let's go back to the main stage. Thank you. Have a lovely rest of the day. Bye.